This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted that you're with us today. Thomas, we got a great program today, but I guess we could unpack a little bit COVID-19 again. COVID-19 is here to stay for a while.
There was the big question of whether it would go away during the hotter months of the year. The obvious answer to that is not. It didn't even put a dent in it.
No, I don't think it's going to go away in Texas, and we're having some pretty intense heat here this weekend.
In your ponderings, why do you think Texas?
Well, I think we did a great job when we really, what I call, flattened the curve at the end of April, first part of May. I know we started opening things up and tried to do it in a very responsible fashion, but then we throw in Memorial Day. You've got Mother's Day we went through as well. And I think especially some of our younger people probably got out and about and started moving around. And unfortunately, the virus didn't go away, so we began to have community spread.
And then you've got these big population centers that we have several of, obviously, in the state, almost 30 million people.
Absolutely. We have a lot of people. And, Thomas, if you look at since June 19th, we've more than doubled the COVID-19 census in our hospitals. Now, thankfully, only a third of those, roughly, are in ICU, but the others are still in the hospital. And we still have people that we call PUIs, people under investigation. We're waiting to get test results. So with July 4th, we've still got 7 or 8 more days to see what impacts that's going to have. We certainly don't want the doubling effect to continue to decrease, which really means the community spread has increased.
When you talk to the hospital executives and teams, can we coexist with this virus if we do our part and wear the mask and wash our hands and distance and do all of this? Can we dance together?
We really think so. And, when I talk to many of the infectious disease docs and epidemiologists, I think from what they say, if everyone would wear a mask, wash their hands, stay out of large groups, do the kind of things we just talked about, physical distance properly, we could coexist with this for a while, at least until we get a vaccine. The problem is we're getting community spread, and what's happening, Thomas, more people are being hospitalized.
My son actually works in one of the area hospitals, and he's saying, boy, we've not seen anything like this. It's jumping up and up and up.
The hospitals really look at 3 key things. 1, bed capacity, 2, PPE, personal protective equipment, and 3, workforce. When I talk to the CEOs, the common denominator is workforce. Having a bed is one thing, but having the staff to service that bed is more important. So our hospitals are looking at their existing staff. Secondly, how can they contract with what we call in the industry traveling nurses to bring in contract labor? And then thirdly, we are working with the state on a 2-pronged program that we have to try to get additional workforce.
It breaks my heart to go out in public and see so many people eating in restaurants, on patios, and in things like the grocery stores who are just defiant about wearing the mask.
That's very unfortunate because Governor Abbott, as you know, said, hey, it's mandatory. We've got to wear a mask. We really commend the governor for doing that. It was the right thing to do. I just wish people would heed his warning and realize that when you do wear the mask, you're protecting your fellow Texan. We had Ashley on here from Texas Scottish Rite talking about unconditional respect. What a better example of unconditional respect than wearing a mask.
It just says, I care about you enough to care to put this on.
I mentioned to you about workforce. There are a couple of things that we're doing to help supplement the workforce. We have a North Central Trauma Regional Area Council, as you know, we refer to it as the RAC. They are an integral part of the state. So hospitals that need additional staff can put a request into them. And then there are two avenues they can do. One, Governor Abbott, through the state, has entered into contracts to bring in additional supplemental staffing. So they look at that. Secondly, when Vice President Pence was here recently, Governor Abbott asked him about workforce. So he said, well, I'll send some DMAT teams down. Now, DMAT teams are disaster medical assistance teams where they send in 36 individuals, including doctors, nurses, respiratory therapists, to supplement needed workforce. So at least we've got two avenues through the RAC that'll help alleviate that issue. So, Thomas, I know recently you drove, not fly, you drove to Florida. What was going on in Florida compared to Texas as far as masks, people physically distancing, going to the beach?
So I went to the St. Augustine area, which is just south of Jacksonville. I took my own food, so I didn't have to stop. As far as the rest stops that I saw, people were wearing masks. I was really glad for that. Convenience stores, not so much. As far as the beach, this was interesting. So St. Augustine is a tourist town, obviously. A lot of patios, restaurants, and the patios, the weather is not as hot as it is here. I got to tell you, Florida is not as hot as Texas, especially in a beach town. So people were on the patios without masks, as the news stories were the case numbers in Florida going up and up and up. I didn't understand it. On the beach, people talk about, oh, the beach is such a bad place to go. It's only bad if you congregate as a group. Now, where I was not, even during the holidays and the weekends, was not heavily congested. So it was very easy to find open space, and you have the luxury of something else, and that is a constant 15-mile-an-hour wind. So once you know which way the wind is blowing, you just stay away from it.
Well, it sounds like you had a pretty good trip. Glad you had a good time.
It was much needed. And, you know, this is part of the thing that we were talking about. We have to learn how we can work together with this. I was over the top of how I was going to protect myself. Once I got there, about 2 trips to the grocery store, I had a little place right on the beach. I didn't have to be around anybody. I was by myself, in and out. I walked right over there to get on the beach where I had plenty of open room.
You know, sometimes people ask me, Thomas, how long have we got to live with this? Well, I wish I knew the answer, but I do know this, and I've said this before. If you look at history, the great influenza, 1918, it was around 2.5, 3 years before it really got under control. Hopefully that won't be the case here, but until we get a vaccine, until we get to some type of herd immunity, we're going to have to learn to live with this. And each of us is going to have to take responsibility for our individual actions.
Coming up in our next segment, Steve, we're going to bring light to something that, you know, it's not. We think about adults. Kids are struggling with this thing too.
Oh, absolutely. And, you know, behavioral health is a real problem in adults, and it's also in children. In our next segment, we're going to learn there's a program at Children's Health to take your trusted family pediatrician and involve them in behavioral health.
A great program for your kids and your family coming up next on the human side of healthcare.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome to the human side of healthcare. We're delighted that you're here today. We're going to be talking about a very important topic dealing with behavioral health and mental health in children and adolescents. We could not have a better expert with us today than Jason Eisem. He's the Director of Integrated Behavioral Health at Children's Health. Welcome to the show, Jason.
Thank you, Steve, and it's great to be here.
Yeah, we're delighted to have you back. We interviewed you earlier in the year, and we had great feedback. So, Jason, as we're talking about youth mental health, what is really the state in your mind of youth mental health here in North Texas?
Well, Steve, Mental Health America has recently published a report And the title of that report is The State of Mental Health in America. And it's interesting, in it, Texas ranks 28th in terms of the prevalence of youth mental health cross-referenced against access to mental health care. We also know that more than 1.4 million Texas children suffer from a diagnosable mental, behavioral, or developmental disorder. 71% of youth nationally with major depression are left untreated. And as a result of this COVID-19 pandemic that we're all living through, there are many behavioral health experts that are expecting and predicting a second pandemic, a mental and behavioral health pandemic brought on by the social isolation and the stress of dealing with COVID-19.
You know, that's amazing. And when you say 71% of youth have major depression and are left untreated, you know, that's kind of scary. And especially when you say Texas ranks 28th in terms of the prevalence of youth mental health and also access, because if I'm not mistaken, 1 in 9 children born in the USA are born in the state of Texas. So this really is a serious issue.
Absolutely. It's a very broad problem and a very complex one at that.
Jason, you know, when we last spoke, you said you were developing a couple of programs, and I want to ask you about one of those programs. Can you provide us an update on the Child Psychiatry Access Network, also known as Cpan? What is it, and can you give us an update?
Certainly, Steve. So as you mentioned, Cpan stands for Child Psychiatry Access Network. And you may remember during the last legislative session, there was a lot of conversation around behavioral health, both in the legislature and in the public discourse. And as a result, the Texas legislature took monumental steps to address access to behavioral and mental health care for children and youth. And they commissioned a group of health-related institutions, medical schools across the state who are concerned about access to child mental health services. And they called that group the Texas Child Mental Health Consortium. And that was born out of Senate Bill 11 during our last legislative session here in Texas. The consortium's job is to administer and implement 2 programs. The first one is the Child Psychiatry Access Network, or Cpan for short. And as the name implies, it is a network of programs across the state divided into regions to provide consultative resources to primary care providers. Here in North Texas, and for your audience, Cpan is powered by a partnership between UT Southwestern and Children's Health. Together, we're going to lead the way in connecting primary care providers with the behavioral health community. Here at Children's and UT Southwestern, we launched Cpan on May 18th of this year, and we are serving a 9-county region, Grayson, Fannin, and Hunt counties in the north, Dallas, Collin, and Denton more centrally, and then Rockwall, Kaufman, and Ellis counties to the south of us. It's also really important to know that every county in Texas is covered by Cpan, so our neighbors to the west are served by a hub powered by the University of North Texas, and our friends to the east are covered by the University of Texas at Tyler. And so every provider in the state of Texas, no matter where they live, has access to Cpan and its services. The whole goal there is to be able to keep behavioral health services and care in the primary care offices. One of the things that we spoke about last time and that we speak about often is that in Texas particularly, there is a shortage of child psychiatrists, particularly those who take payer sources from government sources. And so often there's a long waiting list for a child to see a psychiatrist. And so as a result, one of the solutions that we've identified here in the state of Texas and here in North Texas is to empower and train and enable primary care pediatricians, nurse practitioners, and family practice doctors who do pediatric medicine to really treat their behavioral health patients in their own office. The other great thing to note is that the hubs across the state are collaborating and working together with one another so that no matter where a provider is in the state, they will have access to Cpan. And the really great thing is that there is absolutely no cost for a provider to join Cpan and access those services.
You know, Jason, bringing in the family pediatrician into behavioral health makes so much sense. So when you look at Cpan and you look at North Texas families, what would be the benefits to the children and especially other family members that you really think come out of this program?
Well, there are several, Steve, and the first of which is trust, and they can get to be seen by their trusted family doctor in a setting that's familiar to them. It's also access to care and convenient. In many cases, they can receive their behavioral health care in their primary care medical setting and their behavioral health care in the same place, and so they don't have to go to a separate office. Lastly, and really important for us here at Children's, is the idea of destigmatizing behavioral health care. By discussing behavioral health with your primary care doctor, you can make behavioral health care a part of everyday health care, just like the common cold or strep throat or high blood pressure. The action point for your audience today, Steve, would be to speak with their primary care provider and ask them if they're participating in Cpan and to encourage them to if they are not.
You know, this sounds like a great program. And now that you've rolled it out, I've just got to ask you, with COVID-19 and with many families that had to shelter in place and many families that have been limited as far as some of the things they could do, have you seen some good benefits to help families during this COVID-19 crisis?
Yeah, no, it's certainly not too early. And I think the number one thing is that to know that there's been a disruption in all of our routines, both children and adolescents and parents alike. And we have seen a significant amount of parental stress. And so I would encourage listeners to reach out to their primary care provider to ask about behavioral health resources, ask them if they are participating in Cpan. If their provider is not in Cpan, they can call 1-888-901-CPAN and press option 12 for Children's Health in the UT Southwestern Hub, and they can get enrolled and get some consultative services for their providers so that they can have some behavioral health resources for their families. But I would say make the call, reach out, and connect with your provider and with your support network during this time. It's really, really important.
You know, that's great advice. And to our listeners out there, you know, Jason, some of the things that I really learned as nuggets of information you gave me is, one, how underserved the behavioral health population is in Texas, especially children, and how this program helps fill that niche to help people and tie it into their primary care physician. We really appreciate you being with us today, and we thank you for the work you're doing. And we hope that our listeners will certainly understand the importance of behavioral health and their children. Thank you, Jason.
Thank you, Steve.
You know, Thomas, that was great, listening to what Jason had to say. And, you know, one of the big things he talked about was we got to remove the stigma associated with mental health. And I was just thinking I'd be somewhat remiss. You know, we have a great relationship here with KRLD, but also with their parent company, Intercom. And Intercom every year does a program called I'm Listening to launch Suicide Prevention Week. And embedded in that message, don't be afraid to ask for help. Don't be afraid to seek treatment. Remove the stigma associated with anything related to mental health. What a great message.
That has been a tremendous program every September, so we'll be having that this fall for sure, unlike the state fair, because it's virtual. It's on the radio, so we can do it, right? We can have the program.
Absolutely. Looking forward to it. And Intercom does a fantastic job nationwide with that show.
Now, we've been talking about masks this whole show, and we're going to have another segment toward the end of the show about it. But you know, Steve, there is one time when it is okay to take your mask off.
When is that? When you eat?
No.
when is it okay?
If you're trying to start a family, if you're trying to get pregnant.
Okay. You're launching into our next guest talking about infertility.
Well, because even though we've been sequestered together for so long, you would think that there would be the next baby boom coming in about 9 months, wouldn't you? But you know, a lot of people, on a serious note, do have trouble getting pregnant.
Absolutely. And we couldn't have a better person coming up in the next segment to talk to us about infertility and her advice.
That's right. Sheri Puffer from Women's Health Services in Arlington with us next about infertility and some great tips to improve your chances if you are trying to get pregnant and have been having trouble. That's next on the Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. Today, we're going to talk about a topic that many people may not really think about, but it does impact people: infertility. And this is something that you need to know because 1 in 7 couples are trying to have a baby, and that can influence infertility. Recent studies have shown that after a year of trying, 15% of couples are unable to conceive a child. So we're bringing in an expert today. We're absolutely delighted to have Dr. Sheri Puffer with us. She's an obstetrician, gynecologist on the medical staff at Texas Health Arlington Memorial Hospital, which is in Arlington. Welcome. We're delighted to have you.
Thank you so much for having me. I'm happy to be here.
You know, when we think in terms of what's going on and look at the future, there was a statistic I was given from Premier Health that said by 2020, almost 10 million couples will encounter problems in having a baby. That is unbelievable.
It's a large number. It's actually something I do see in my practice all across the age spectrum. I feel like many people are delaying childbearing, to age 35 and up because we put our careers first as women and just things get in the way and we instead want to have children later. After 35, you're considered advanced maternal age, basically geriatric. But, after 35, you're run higher risk. Infertility is part of that. I feel like when you're older, you have more medical conditions. That's a big part of infertility. Do you have chronic high blood pressure? Do you have diabetes? Are you morbidly obese? All these things can go into infertility.
So age does come into play. People really need to think about that.
They do. And, having children is one of the most wonderful things that you can do in your life. And I want to caution people not to delay too long because at one point you might not be able to have the family you wanted and might need to go through assisted technology, which luckily we have so much of that available today to help families that want to get pregnant.
So there is technology and things you can have to help you that you didn't have, say, 10 years ago.
Absolutely. We have our reproductive endocrinologists who are OBGYNs who have done more studying, and they focus basically on pregnancy or getting people pregnant, I should say. And that's wonderful because they're able to do so many different things. Not everybody is able to get pregnant, but they increase the likelihood greatly.
To our listeners that are listening to you now, that thinking in terms of starting a family, and especially obviously the females, what lifestyle or habits should they practice that would help them as far as fertility?
That's a great question. I feel like if you can develop really healthy habits in your 20s, exercising daily, eating right, not becoming morbidly obese, if you have a family history of diabetes, that's a huge risk factor for you. You're walking down that path. In America, we have an overabundance of processed foods available to us, and it's much more readily available than eating healthy. So we all fall into that trap. So I think that if we can make sure to maintain health, and of course, no smoking, limit your alcohol intake, all those things for men and women are very important.
As you were talking through, before you even mentioned the word diabetes, you were talking about eating healthy, getting good physical exercise, and not being obese. I immediately thought of diabetes. So some of the good health habits that you practice for other chronic illnesses can help be a positive influence on fertility.
Absolutely. And for infertility, there's male factor and there's female factor. So, it's really, I tell my patients it's 50-50. I, of course, focus more on the female in my practice, but we definitely talk about our partner. Is he healthy? Does he smoke? Does he drink? Does he use illicit drugs? Does he have any chronic medical issues? I make sure that he goes and gets a semen analysis. We want to make sure he has, I call them good swimmers, and they can talk to their partner about that. Because many men feel a little uncomfortable going to do this, but I want to urge them that it's not. We do this all the time, and it's a great thing because 50% could be you, and you don't want to be the limiting factor.
You mentioned smoking. So I want to go down that a little bit. I look at it, and I do a lot of work for organizations trying to stop smoking in public areas, be smoke-free, have smoke-free ordinances. And I want to commend Arlington. Arlington recently, within the last couple of years, went smoke-free, so did Fort Worth. Smoking can influence fertility.
Absolutely. It's been proven to decrease the motility of the sperm. So that's why it's both male and female. Fertility is definitely affected by that.
This is probably a question you can't answer, but I'm going to ask anyway. As I look at combustible products, and probably there's not enough research, I just wonder, is vaping going to have an influence on fertility? And you probably don't know.
I don't know the answer to that, but I definitely caution my patients for every reason not to vape. And I definitely have a younger subset of population that they vape. And I counsel them strongly that this is going to lead down the path of bad things. And I don't know exactly what it's leading to, but I don't think there's no good evidence showing that it's safe.
You mentioned age, and you think in terms of medical conditions. Let's say endometriosis. Have you seen this influence women as they get older, or is there any correlation?
So endometriosis is a chronic, basically pain disorder in the pelvis. We think from menstruation, it goes backwards, implants on the inside of your pelvis and causes pain, cyclical, especially with the menses, but also throughout the month. It can cause pain with intercourse, all sorts of problems. But the biggest issue with fertility is it can scar the tubes, close the tubes. So therefore, the egg can't travel into the tube to fertilize with the sperm. So it definitely has an impact on fertility.
What would you say to our listeners who are out there and they're thinking of starting a family, or maybe they've tried to start a family and they're not getting pregnant? What would you say is kind of the first line of thinking or first line of treatment for fertility?
I would definitely urge them to come to see their OBGYN just for a consult. We recommend women have a yearly exam. It's a preventative visit, a maintenance visit, basically. I talk about so much of this at that visit. After 12 months of unprotected intercourse, you should be pregnant with the odds. And if you're not, then it's time to have a consultation. I like to do some lab work. I like to make sure that you're healthy. We talk about these lifestyle modifications that I was mentioning earlier, and we make sure your partner's healthy. There's also things in your history. If you've had a history of pelvic inflammatory disease, chlamydia, gonorrhea, even if it was remote, that could have scarred your tubes enough where that tube is not open, allowing the egg to pass. And there's some imaging modalities that we can use to find out, is that the case?
You bring up some really good points. And, you think in terms of what you said earlier, 50-50. It's a 50-50 proposition. But men also need to be responsible. They need to think in terms of their health habits. And as men get older and they age, does that influence fertility?
It does. Men do make unlimited sperm, so they're able to father children until very late in life. Medical issues do prohibit them, continuing with the sperm if they can't have an erection. That can be a huge problem for them, but the sperm is made all the time. Women have the issue where we have a limited number of eggs when we're born, and over time that diminishes until they're gone. But men, maintaining their health is going to be super key for them as well.
As we do these shows and we call it the human side of healthcare, this truly is the human side of healthcare. As people begin families and as people bring new life into the world. So, Dr. Puffer, our listeners who are hearing you today, who have tried, say, for the last 6, 8, or 12 months to conceive and they haven't, what would be your advice to them?
My advice would be to definitely seek the care of a professional. If not me, somebody close to you, location-wise, because you'll want to have a journey with them. And most of the time, we can recommend steps to hopefully relieve your stress and not becoming pregnant, because it is an anxiety-provoking situation when you're ready to start a family and it's not happening. It's very stressful. Every month, not having a positive on that pregnancy stick, it really makes you upset. And stress actually works in the opposite factor for getting pregnant. We think stress works against you. Just like anything, it diminishes our immune response, we think, to everything. So I would definitely recommend the listeners seek the care of an OBGYN and have a great consultation, and we'll try and get you pregnant.
Healthcare is really interrelated. And as you were talking, you focus on the health of your patient, obviously, and you want your patients to practice good health habits. And they certainly want to be fertile so they can conceive. Another thing you have to think about, if you've got people that really aren't healthy and they aren't practicing good health habits and they do conceive, they could have complications with the pregnancy. And then unfortunately, we have a high rate of maternal mortality here in the state of Texas. Do you see the correlation?
I definitely see the correlation. It's a great question that you asked. We have a large practice. We have 5 women in our practice. And so we deliver, I believe this month we're having 90 babies due within the practice. And so many of my patients, I really see obesity as a huge problem. So many of my patients start at 300 pounds. That's before they get pregnant. And then they have chronic diseases on top of this. So all of this goes into the maternal mortality risk. So we're not talking about 22-year-olds with a normal BMI. These are, in your 30s, chronic disease, morbid obesity, which puts them at higher risk for a C-section, which is a major surgery. They have so many more risk factors. They have to see the specialist more often. It uses a lot of healthcare dollars, and it really contributes to the rate, I believe, of the maternal mortality in Texas.
And as Dr. Puffer mentioned, she is part of a multi-physician group called Women's Health Services. And conveniently, their website is womenshealthservices.com, and they're located in Arlington. Now, when we come back, it's a call to arms, folks. We have got to slow this spread down in North Texas, and we're going to learn how next here on The Human Side of Healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is The Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to The Human Side of Healthcare. We're delighted that you're with us today. We hear a lot about COVID-19. We've talked about it. There are some things that each of us should do, need to do, and must do to stop the community spread. One of those things is wash your hands frequently. The other is to physically distance yourself. But the most important thing you can do, and we hope our listeners out there understand, is to wear a face covering or wear a face mask. It is so important. And we want to explore this a little more, drill down a little more, and explain to you why this is so important. We could not have a better person to interview today than Pat Jackson. She's the Senior Director of Infection Prevention at Children's Health. Welcome to the show, Pat.
Thank you very much. I'm happy to be here.
I'm just going to start right out. And how do face coverings, face masks, protect people from COVID-19?
That's a great question. I think in order to answer that, I need to make sure our audience understands how COVID-19 is spread. So the COVID-19 virus is spread mainly from person to person through respiratory droplets produced when a person does something like coughing, sneezing, talking, singing. If you're in close contact with that person when this happens, and that is about within 6 feet, these droplets can land in your mouth or nose. And this is how the virus enters your body and potentially how you can become infected. Recent studies have shown that people with COVID-19 may not even have any of those symptoms and not know that they're sick. We call that being asymptomatic. So the purpose of wearing the face covering is to contain those respiratory droplets and prevent them from traveling in the air so that others don't become exposed. So wearing a face covering is protecting those around you, including those who could be at very high risk for getting severe disease. You're protecting others when you wear the face coverings, as sometimes you might not even know that you're infected. So the face coverings are more likely to reduce the spread of COVID-19 when they're widely used by people in public settings. So that is why it's very important for everyone to wear them when they're out in the public.
Thank you for taking time to really explain that. And let me tell you why. I have a good friend who went up to a person the other day that wasn't wearing a mask and didn't do it in a rude manner, but just said, "Why aren't you wearing a mask?" Said, "Well, I don't really feel bad." And said, "Well, you could be asymptomatic." And they said, "What is asymptomatic?" So, I think we need to really take the time, just as you did, and explain to people, hey, you may not be showing symptoms, but you could be contagious. With that said, who should wear a mask or a face covering? And more importantly, when should you wear it?
That's another great question. So the Centers for Disease Control and Prevention recommends that people wear face coverings in public settings anytime they're outside of their household. So this is especially important when social distancing measures are difficult to maintain. For instance, when you go to the grocery store, you can't always control when someone is within 6 feet of you. So that would be a really important time to wear a face covering. And face coverings should be worn by everyone except those who are under 2, anyone who has trouble breathing, or anyone that is unable to remove the face mask without assistance. So it's really almost everyone should be wearing a face covering when social distancing cannot be maintained.
You mentioned going to the grocery store, and sometimes when I'm in the grocery store, I see people with a mask, but it's like slipping down their nose and slipping below their mouth, and they're wearing it on their chin. Can you tell us, so our listeners truly understand, the proper way to wear a face covering, especially when they're out in public?
Yes, I certainly can. And I have seen those very same things when I've been out in the public. The first thing to do before you even put on your face covering is to make sure that your hands are clean. So you do that by washing them with soap and water for at least 20 seconds. Or if you don't have access to soap and water, you can use hand sanitizer. So start with clean hands, and then you're going to there's all different kinds of face coverings. Some people might have those that tie in the back. Some people might have those that have ear loops. So you're going to put on your face covering over your nose and mouth. You're going to make sure it's secured under your chin. You want to try to make sure that it fits snugly on the sides of your face and that it's not gaping. You don't want to put the face covering around your neck or forehead when you're not using it, for instance, when you get back in the car, because the outside of that is potentially contaminated and you don't want those germs to get on your skin. When you're removing the face covering, it's important that you don't remove it from the front of the mask, because that is the part that is probably contaminated. So you're going to remove it from the sides or the back. So for instance, if you're wearing a mask that has ear loops, you're going to remove it by taking the ear loops off your ears. If it's a tie in the back, you're going to untie it. You just want to make sure that you don't touch the front of the mask. If you do touch it, then you would obviously perform hand hygiene. Another thing that's very hard to do is not to touch your face when these masks are on. So you want to try as much as possible while you're wearing that face covering to not touch the actual face covering, because again, that can be contaminated. But if you do touch it, you can always do either wash your hands or use the alcohol hand sanitizer. And then after you take off your face covering, again, it's always important to clean your hands again.
So let me ask you this. How often should you use the same mask?
It depends on what mask or face covering you're using. Sometimes there's face coverings that are not washable or cleanable. So for instance, if you came to Children's Health today, you would get a disposable face mask and you would use it that day, and then really it's best to throw it away. Some face masks, though, are the cloth ones that are reusable, and you can use those over and over again, but you would want to regularly clean them, probably on a daily basis. And the CDC actually has special recommendations on how you can clean those cloth face covers. You can actually just put them in your normal laundry cycle, use normal laundry detergent. You want to use the warmest water setting possible. If you're washing by hand, you can use a bleach solution. So you can mix 5 tablespoons of bleach with about a gallon of water. The funny thing about bleaches is that they're not all disinfectants. So you want to make sure that you read the label of your bleach to make sure it actually can disinfect. Some of the bleach products that are used, for instance, for colored clothing actually aren't disinfectants. So if you're using a bleach solution, you would want to soak it in the bleach solution for about 5 minutes and then rinse it with cool water. And then you're going to dry it. If you have a dryer, you're going to use the highest temperature setting on your dryer and leave the face covering in there until it's completely dry. If you're going to air dry it, you want to lay it flat and allow it to completely dry. And if possible, even put it outside, because we know that sunlight is a good way to kill that virus also.
Pat, regardless of whether the governor has initiated a mask order or whether that's being enforced by local law enforcement, it seems to not matter. People are generally still not wearing masks. Is there something that you have talked about or discussed as should be a good protocol if we are in public and somebody is around us without a mask? What do you do?
Yeah, what I try to do, because it happens a lot, is I try to maintain that distance from them when at all possible. If I'm in the grocery store and I'm walking down an aisle and I see someone without a mask that I am coming upon, I'll actually leave and go down another aisle. So I think what you have control over certainly is trying to maintain that distance. And this, again, is why everyone wearing face masks is so important.
You know, all of us here on the production team of The Human Side of Healthcare agreed that if this message just reached one person who has been reluctant or not wearing a mask, it would all be worth it. Let's all step up and do our part to slow the spread in North Texas. Have a great and safe week. We'll see you next Sunday on The Human Side of Healthcare.